So welcome everybody to your 2020 enrollment. On the screen are the things that we will cover today: your medical benefits with Aetna, your dental offerings, your vision, and then voluntary offerings as well. Your open enrollment begins today and will terminate tomorrow. Unfortunately, we do need to either get an enrollment. Yes.
Ma'am, LS Laura Davis is having a hard time getting on. Can we pause for just one quick moment?
Okay, so open enrollment begins today, and we do need an enrollment form or waiver from everybody as soon as possible. We have the deadline here set for tomorrow into business. And the reason is obviously the 25th, most places of business are closed, and then we'll need time to process and get back to everyone in the event that we have questions. Reminder in regards to eligibility, so all employees that are considered full-time are eligible for benefits. Additionally, legal spouse, domestic partner, and children up to the age of 26 are also eligible. The benefits that you will review and enroll in, you are going to be locked into those benefits for the full 12 months beginning January 1. So all the pre-tax benefits, medical, dental, vision, you're locked in for 12 months unless you experience a qualified event. On the screen, there are some examples of qualified events, your typical marriage, divorce, loss of coverage, birth of a child, things of that nature. You have 31 days to notify your team here at CBR. You want to reach out to Marlene as soon as possible so you have the opportunity to review any benefits or make any changes that are needed. The only exception to the 31 days is eligibility or loss of Medicare, Medicaid, or coming on or off of the public exchange or federal exchange, better known as Obamacare. That will allow you 60 days. But we still recommend you reach out to us as soon as possible so we can make the changes that we need to make internally. We're going to go over 2 of the medical plans that are being offered. You have a total of 3. So all of the plans are on what we call the OAMC, or Open Access Managed Choice Network. Everybody should have received a benefit guide that has information in regards to how to research the network and find if your current provider is in the network or find new providers within the network. So this first plan is called the Open Access Managed Choice 2500. This is a $2,500 deductible for an individual, $5,000 for the family. On this plan, when you have to worry about deductible is urgent care, emergency room, major medical such as inpatient, outpatient surgeries or hospitalization, MRIs, CAT scans, durable medical equipment. That's what's going to trigger your deductible. If you happen to meet your deductible in a calendar year, then you're going to go into that cost share with Aetna. Aetna at that point will pick up 80% of your cost, and you will be responsible for 20% until you reach that maximum out-of-pocket. So the maximum out-of-pocket, and this is true for all 3 of the plans, once you reach that, you will be into 100% coverage within a calendar year and for in-network services only. And then on this plan, if you need to go see your regular doctors, PCP, your walk-in specialty clinics, convenience care clinics, or your specialist, it is a $35 copay, but you are limited to 5 visits at a $35 copay per year. If you happen to exceed the 5 visits, then you will pay the contracted negotiated rate. You may use the telemedicine that's available through Teladoc, and that you can use anytime, and it does not count against the 5 visits. Keep in mind your preventative care on this plan and all of the plans is covered at 100%, so that as your well man, well woman, well child checks. So under healthcare reform, we are entitled to 63 preventative screenings dependent on age and gender. So make sure you contact your primary care physician and get those scheduled. As I stated earlier, on this plan, your urgent care and emergency room are both going to be subject to your deductible. You want to make sure to show your Aetna ID card, and you will pay the contracted negotiated rate. Your prescription that's available before your deductible, you have a 30-day retail supply available. You're either going to do $3 or $10 copays for your generic. Your preferred brand name medications, $35. Your non-preferred, $60, and your specialty drugs are going to be 25% of the cost, up to $250. Now, if you are on some kind of a maintenance medication or take maintenance medication on a regular basis, you can use the Aetna mail order. It is a 90-day supply for 2 copays, so a little bit of a savings there. The next plan is the Open Access Managed Choice HDHP 3500. This is a high deductible health plan, which means everything is going to be subject to the deductible with the exception of preventative care, preventative medication, and FDA-approved contraceptives. Everything else, including pharmacy, is subject to your deductible. So how the plan works is you show your Aetna ID with whatever service that you're going to be receiving. You're going to pay the contracted negotiated rate until you meet your deductible. On this plan, it's $3,500 for an individual, $7,000 for the family. Once you meet that deductible, you're going to go into that cost share of 80-20 until you meet your maximum out-of-pocket. Once you reach your maximum out-of-pocket, then you will be into 100% coverage. Keep in mind, if you meet your deductible on this plan, the prescription changes to copays. So you don't have to pay the full retail price of prescriptions after the deductible. This plan allows you to open a health savings account, or HSA, and put aside pre-tax dollars and that you may utilize towards your medically qualified services. Now, the pre-tax deduction helps in lowering your taxable income, goes into an HSA account, and you can utilize it to pay for your pharmacy, your co-pays. You can use it for vision or dental. And whatever money is in that account is your money. You own the account. There is no use it or lose it provision. You can carry it over year over year. In your benefit guide in pages 8 and 9 is additional information in regards to the HSA, and we'll go over in the next couple of screens additional information on the HSA. Does anybody have any questions on these 2 plans? Okay, we're going to move forward to the last medical plan that's available. Again, the Open Access Managed Choice, or OAMC. The deductible on this plan is $6,350 for an individual, $12,700 for the family. On this plan, what goes towards deductible, when you have to worry about deductible, is urgent care, emergency room, major medical services, again, inpatient, outpatient, surgeries, hospitalization, and specialists. All of those are going to be subject to your deductible. There are copays available on this plan for your primary care physician, convenience care clinics, telemedicine. Those are going to be a $25 copay. Your specialist, your urgent care, and emergency room are going to be subject to your deductible first. Now, if you meet your deductible on this plan, you're going to be into 100% coverage because the deductible and out-of-pocket are exactly the same. Your medication, exactly as the other plans, and it is not subject to your deductible. So you have access to those medications at copays prior to your deductible. Any questions on this plan? Okay. This is about the HSA, the health savings account that you may open with the high deductible health plan. So as I spoke to earlier, you may set aside pre-tax dollars, helping lower your taxable income, so it's more money in your pocket. You use that money for all qualified medical expenses. You can use it for medical, dental, vision, pharmacy. You may use it as long as your doctor writes a script for yoga, Pilates, massages, chiropractic services. You can use those HSA dollars. Now, if you have a very good year where you just go in for your preventative care that's covered at 100% on the high deductible health plan, you can stockpile that money and carry it over into the next year, and so on and so forth. So with our partnership with UMB Bank that you'll find on the benefit guide, page 9, once you reach $1,000 $1,000 balance in that account, you may start to invest those dollars. Any interest earned in that account is also going to be tax-free. So that's a second opportunity to save on taxes. Then as we start to age and we become Medicare age or Medicare enrolled, we can start to utilize that money to pay for Medicare premiums, withdraw money for medically qualified expenses, and that's also going to be tax-free. So it's a triple tax savings vehicle, the only one available right now in the U.S. So again, as I stated, this money is fully portable. You own the account, no use it or lose it provision. There is no minimum to put into the HSA account, but there are maximums. So for the 2020 plan year under IRS rules, the maximum an individual may put into an HSA account is $3,550. As a family, under IRS rules, a family is considered one plus, so it could be one plus a child, spouse, or an entire family, is $7,100. Now, if you're 55 or older and not yet enrolled in any part of Medicare, you can add an additional $1,000 to those annual maximums. There are some caveats or rules, if you will, to opening up an HSA account. First and foremost, you must be enrolled in a high deductible health plan, which you have one available. You cannot be enrolled in another plan that's a non-qualified plan or non-HSA plan. You cannot be enrolled in any part of Medicare, and you cannot be claimed as a dependent on another person's tax return. Those are some very important things to keep in mind. Any questions on the HSA? Okay. Also keep in mind with the HSA, you will get a debit card to utilize to pay for services. The money in the account is made available as it's taken out of your check, so it's not front loaded like an FSA. Speaking of FSA, so the Healthcare Flexible Spending Account, or FSA, similar to the HSA. A couple of differences between the two. Number one, whatever amount you elect on the FSA, which carries an annual maximum of $2,500, will be front-loaded on your Visa debit card. So if you enroll, once you get your debit card, it's going to have the full amount, and they will debit it from your paycheck over the next 12 months. So if you elect the full amount of $1,200, and it'll be available as soon as you get the card. And then a couple other differences. If you leave the company, you do not take it with you unless you COBRA the benefit. It has a maximum of $500 carryover into the next plan year, which means if you have a balance of, let's say, $700 on December 31st, 2020, you're going to lose $200. The most you can carry over is $500. Now, you may enroll in the flexible spending account if you do not enroll in a high deductible health plan. If you enroll in the high deductible health plan, it's recommended that you enroll in the health savings account. Those work well together. You may enroll in the flexible spending account with the other two plans, and you don't even have to enroll in medical to enroll in the flexible spending account. You can waive all the medical. Let's say you're enrolled in a spouse's or domestic partner or another type of plan. You may enroll in the flexible spending account, take advantage of those pre-tax deductions, and you can use those dollars to pay for medically qualified services for yourself and all dependents. You also have the Dependent Care FSA, and this, again, pre-tax dollars up to $5,000 in a calendar year that you may set aside to pay for child or adult daycare. Again, you elect a certain amount and it's deducted from your check and placed into an account to utilize to pay, again, providers or yourself back. Any questions on the flexible spending accounts? Okay, we have available some Aetna resources, so I highly recommend once you get your Aetna ID card that you go on to Aetna.com and create a login so you can start to take advantage of some of the services that are available at no cost to you in the Aetna portal. You have a nurse online available 24/7, 365. Keep in mind these nurses have your medical records at their disposal, so they'll be able to speak to you in regards to prescriptions, side effects, interactions, and help you guide you with care, urgent care, emergency room, etc. Global Fit, it is a wellness discount program that is available. So there's wellness coaching available, wellness program. You may complete your health risk assessment online, and then you can take advantage of some of the discounts that are available through the Aetna portal. Aetna also has a mobile app that you can download. You can find a pharmacy, you can view your ID card, things of that nature. And then your telemedicine that is provided through Teladoc. So everybody enrolled in the Aetna plan has the telemedicine available. It is available 24/7, 365, and it is monitored, answered by board certified physicians. So everybody enrolled has access to it. So your copay depends on what plan you're enrolled in. If you're enrolled in the high deductible health plan, you're going to pay $45. So you can use your FSA or HSA account to pay for these services. I do recommend that you go onto the portal, update the information, create your login, and then download the app to your telephone. They will require a form of payment for the services. So aside from the general medicine like colds, flu, sinus infections, UTIs, they can also treat, they also have specialists like dermatologists, psychiatrists, and psychologists available. And you will have access to a wellness program beginning in 2020. Once you receive your Aetna ID card, you can take advantage of it. If you are an iPhone user, Aetna and Apple have a wellness collaboration. They came up with an app and ways to make us, healthy by giving us some wellness goals using our Apple Watch and our iPhone. So it is an app that you download to your iPhone. And you can, if you have a smartwatch or Apple Watch, you can start to pair and earn points immediately. If you do not have the Apple Watch, in the app, you will have the opportunity to purchase an Apple Watch at a discount. And it is a 24-month contract with Apple. And depending on which model of watch you pick, your monthly payments may be as low as $8 a month. However, if you meet your wellness goals month over month, you will not pay anything for your watch. And then any points in excess, you can cash those in for gift cards. So these are actual screenshots from my telephone. This is the Attain app. Very easy to use, very easy to navigate. It guides you through how to set it up, how to enter your information, because you are asked to enter your personal information on the app. On this screen, you can see that I have completed some healthy actions, and the healthy actions are very simple and attainable. It is like going for a walk, standing, doing breathing exercises, and then you get other notifications on your telephone from Aetna, like get your wellness check, go get your teeth cleaned, things of that nature. And as long as you acknowledge the activity, you earn the points. So at that point, I had only obtained 845 points, and I owed $8, and I had a balance of $192 for my watch. However, as you can see there, it says you earned 845 points, but if I earn at least 8,000 points for the month, then I pay nothing for my watch. And then any points in excess of the 8,000, I can start to cash in for gift cards. Again, so the watch can, if you have one, obviously you can start to earn those points for the gift cards at no cost. And if you don't have a watch and you purchase it through the app, it's a really good way to obtain a phone at a discount or free. And then you gain some gift cards as you work your way to wellness. The middle screen or the middle phone there, one of the challenges, go for a walk and you acknowledge, and then it moves it to the next step. At this point, this person had only owed $2.75 for their watch, so they may have purchased a more expensive watch than what I purchased, because mine is 8,000 points and it's $8. So it's a really good way to work your way towards wellness. Again, it's very attainable. If you have any questions in the interim, please reach out to me. If once you get your Aetna ID card, you have questions on the app that I may help with, reach out to me. Next, we're going to go over the dental plans. So you do have 3 dental plans available. So the first plan is called the PPO base plan. So you'll get your preventative care covered at 100%, which is cleanings twice a year and your x-rays. Your basic services, such as a cavity or emergency services, it's going to be an 80-20 cost share. So Delta will pick up 80% and you pick up the 20%. And when you engage those basic services or major services, you will be subject to a one-time deductible of $50 as an individual or $150 as a family. And again, that's one time in a calendar year. Major services such as endodontics, periodontics, crowns, things of that nature, it's going to be a 50-50 cost share. And then you, all while deducting from your maximum of $1,500 to use towards your dental services for you and each person enrolled in the plan. And then this plan also has an additional $1,000 to use towards child orthodontia. As you can see from the screen, the PPO base plan pays exactly the same in and out of network. So if you have a dentist that's not contracted with Delta and you want to continue to use them, you may do so. Delta would pay them. Difference with an out-of-network provider is they have the ability to balance bill you, as they do not have a signed contract with Delta. The next plan is called a DHMO plan. So the DHMO plan does require you to select a primary care doctor or dentist. You and each member that's enrolled may have their own dentist, and you can change it at any time. If you do not select a dentist, Delta will assign one based on your home zip code. Again, you may change the provider at any time. Your preventative care services on this plan is covered at 100%. Cleanings twice a year and x-rays. Additional cleanings on the DHMO are $45, and you can get as many as you want throughout the calendar year. Your basic services, your major services, adult, child orthodontia are all going to be covered under a fee schedule. On this plan, there is no annual maximum. You can utilize a plan as needed throughout the year. And this is the third plan that's available. This is the PPO Buy Up 2 plan. So this plan, again, preventative care services covered at 100%. Your basic services, now it covers more, so it's going to cover 90% and you're going to pick up 10%. And then the basic services under this plan covers a lot more. So it now engages the endodontics, periodontics, which is root, gum disease, cavities, emergency services. Those are all going to now fall under basic services. Your major services are going to be your crowns, dentures, implants. Those are going to be your major services. Again, when you engage the basic or major services, you will have that one-time annual deductible. On this plan, your annual maximum goes up to $2,000 per person enrolled in the plan, and the orthodontia also goes up to $2,000, and it's now for adult and child orthodontia. And again, the out-of-network pays exactly the same as in-network. This is a screenshot of the fee schedule for the DHMO plan. So everyone should have received this as well in the email. So you can go through the fee schedule and review all the procedures that are on there. Everything will be either have a dollar amount associated or as you can see on the screen, this is a diagnostic or preventative that's at no cost. Now on all of the Delta plans, there are no waiting periods, which means you can access the basic and major services immediately. There is no missing tooth clause, which means if you want to get a replacement, either an implant or bridge, you may do so without any problems. Delta Dental will send out ID cards as well, so you should receive it probably beginning of January. You'll receive an ID card from Delta. If you enroll in the DHMO program, you will receive a letter with your ID card similar to what's on the screen, and it'll name your provider. It'll also give you instructions on how to change your provider if you need to do so. Any questions on the dental plans? Some resources available on the website for Delta Dental. I recommend that you also create your login for a Delta Dental and take advantage of the resources. They also have a mobile app. Highly recommend the mobile app. You'll be able to have your ID card on the app and find a provider if you need one. Next, we're going to go over the vision plan. So the vision plan is through iMed, and it is using the Insight network. So on this plan, you have your eye exams available every 12 months for a $10 copay. Your frames are also available every 12 months, and you have a $120 allowance to use towards your frames. And then if your frames are more expensive than that, you get a 20% discount. Your standard plastic lenses, single vision, bifocal or trifocal, are going to be a $10 copay. Then any lens treatment that you want, polycarbonate or tinting, they're all going to be a copay versus a percentage of charge, so you'll experience some savings there. Also, your contact lenses in lieu of lenses for your frames, you have an $80 allowance and a 15% discount over the balance. Medically necessary contact lenses are going to be covered at 100%. Next, we'll go over the life insurance, life and AD&D. So because of the new relationship with CVR, you are entitled to enroll in the life insurance at a guarantee issue. What guarantee issue means, there will be no medical underwriting performed. So if you've been previously denied due to an existing medical condition, or you think you may be denied, this is a perfect opportunity to purchase the life insurance. It is with Unum, and the guarantee issue is 5 times annual earnings up to $200,000 for yourself, $25,000 for spouse, and $10,000 for children. Now, additional life insurance is available up to $500,000. Anything in excess of the $200,000 will require medical underwriting. Even if you enroll this time around in the minimum of $10,000 for yourself, $5,000 for spouse, or $2,000 for children, in the coming years, you can increase as long as you stay within that 5 times annual earnings up to $200,000. Again, it will be a guarantee issue, which means no medical underwriting. It is a very good opportunity. And in your 2020 enrollment packet, the very last page has the rates. Remember to add the additional 20 cents for the AD&D, accidental death and dismemberment, doubling the amount that you've elected. Any questions on the life insurance? Okay. Also available is a voluntary short-term and long-term disability. So the short-term disability covers 60% of your pre-disability earnings, and it will cover up to $1,000 a week. The benefit begins after the 14th day of accident or sickness, and the benefit duration is 11 weeks. The long-term disability, similar, 60% of your pre-disability monthly earnings, up to $7,500 a month. The benefit elimination period is 90 days, and the benefit lasts until normal Social Security retirement age. There is a pre-existing limitation on both the short-term and long-term disability. It's called the 312, which means if 3 months prior to the effective date, you saw a provider, took medication, or were diagnosed for a condition in which you go out on claim in 2020, it will be excluded from being compensable for 12 months. If it's any other unrelated condition, then that will be paid. You also have AFLAC available. The AFLAC, again, is 100% voluntary, and these are indemnity plans, which means they indemnify the owner of the plans. So if you enroll in any of these plans and you seek medical attention, AFLAC will pay you directly. AFLAC does not coordinate with providers, with doctors, or networks. They pay the owner of the policy directly. Also, if you enroll in any of these policies, they're 100% portable. You own the policies. And then at whatever age you attain them or enroll in these policies, you stay at that same rate for the duration of the policy. So really good benefits available here. If you have questions or need additional information in your enrollment packet, there's a contact sheet in there and then explanation in regards to the benefits as well. Or you can reach out directly to me and I can put you in contact with an AFLAC representative. Other items that are available, 100% voluntary again, you have Legal Shield and ID Shield and United Pet Care. These you do have to enroll online, and there's additional information in your enrollment packet. Just follow the instructions in there on how to enroll. So the Legal Shield has unlimited legal assistance available. Your standard will prep is going to be at no cost to you. They can write letters on your behalf, and you also have 24/7 emergency services with attorneys. ID Shield, credit monitoring, so helps you restore in the event that you become a victim of identity theft, or they help prevent it by monitoring your credit and letting you know if there's any suspicious activities. United Pet Care. United Pet Care contracts with veterinarians throughout the United States to offer deep discounts for, things such as regular checkups, rabies vaccines, and things such as surgeries and prescriptions that are needed. There are no pre-existing condition limitations, and there are no breeds that are excluded. And as a reminder, the forms are due by end of business tomorrow. Everybody should submit either an enrollment form or a waiver. Your life and disability forms only if you're enrolling. Your flexible spending account only if you're enrolling. And then the health savings account, remember to, if you're going to enroll in the high deductible health plan, remember to visit page 9 of your enrollment guide and follow the instructions that are on there, and open up your account as soon as possible. Does anybody have any questions, or does anybody want to review the forms that were sent out, the enrollment forms? Any questions? All right. With that, I thank everybody. If there's anything else that is needed, please contact me. I will send out a YouTube link later today with this presentation. Thank you, everybody.
Thank you.
Thank you.